How was that experience? I mean, can you tell us a little bit about how does that even happen? How does someone get diagnosed with autism? Medicine for anxiety was being increased, right? Psych meds were being increased, and she still developed motor tics. You wanted to proceed with a natural treatment. What was the decline in her speech and language that you saw as she went into this depression and spectrum behaviors?
Welcome to the BioNexus Health podcast with Dr. Jodi A. Darshaw, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodi A. Darshaw.
Hi, Resi. How are you? How's California today?
Hi, Dr. Dasher. I'm good. Yeah, it's a good weather right now here in California.
Yes.
So yeah, nice to see you.
Nice to see you as well. Thanks so much for being here.
Thank you also, for guesting me here in your podcast.
Oh, of course, yes. Your daughter in her teenage years was diagnosed with autism. So, how was that experience? I mean, can you tell us a little bit about how does that even happen? How does someone get diagnosed with autism in their teenage years where, she was doing fine? And then what exactly happened?
So just to start with, like 2019, we migrate here, and then she's doing well. She's doing well in the school, and then after how many years, we moved to a house that I never aware of molds before, and then it started with after 3 years, it started with a brain fog, and then the school psychologist just noticed it for my daughter, and then suddenly she's not looking like an eye contact. She loses her eye contact, and then sometimes she just she doesn't recognize that she hit the post. Sometimes.
How old was she then?
We moved here like she's the 2019, around 9 years old.
She was 9 years old when you moved to California from the Philippines.
Yes.
Right, and then you moved into unknowingly into a mold-filled home that had a lot of mold in it. And 3 years after exposure, she started developing brain fog.
And then also the one like I noticed she complained like because 2 years she's doing well in the school. She had like good grades, and then suddenly she complained that, "Mom, I cannot understand what I'm reading."
Medicine for anxiety was being increased, right? Psych meds were being increased, and she still developed motor tics.
Yeah, she developed a lot of symptoms, a lot of panic attack, and the last I remember, she's been in the emergency also for a suicidal, like August 20 last year, 2023, right? Before I met you.
Yes. Yeah. You wanted to proceed with a natural treatment?
Yeah, then the school just assessed her for autism then because not yet, because the diagnosis from the hospital is not autism, because they said she's doing, they can talk to her. But like that time she doesn't have the hand flapping. Then the hand flapping shows.
The hand flapping started. Okay.
Before I met you, like it started to show one by one, and then so the school psychologist assessed her for like behavioral, and then they said it's a autism, or they're not giving like exact because they're not allowed, but like the assessment, it's a spectrum.
Yes, so she was diagnosed as being on the spectrum. Okay.
Yes. So I didn't have a chance for official diagnosis that time.
Yes.
And then, yeah, from then, I find like a natural medicine for autism because I am not aware for autism. And then I found you with Karen for
Yes, yes. What was the decline in her speech and language that you saw as she went into this depression and spectrum behaviors and diagnoses?
Yes, before she's not like that because at the 9,
The
she's
normal 9-year-old, right? You know, she
yes,
was
she's
a
kind of
neurotypical 9-10,
matured.
right?
Yeah,
She was mature.
but I just noticed like she started like age regression. She's acting like yeah, and then language. She speak like repeatedly. I mean, one word again. She asks repeated question. Assurance of because of the OCD. Yes.
Anxiety, the OCD. Okay, so she started behaving like she was a 5 to 7-year-old.
Yeah.
Instead
and she doesn't have like a social cues whenever she want to speak whatever she want. She don't have like
how did you feel when you saw everything that we found in the labs we ran for her?
I didn't expect that because she's been in the emergency, so they did the MRI.
Yes.
They did the spinal fluid test,
Oh,
blood test.
Okay, spinal tap was done as well, right?
Yeah, the first emergency she had, and then nothing in the test result. So they just suggest or recommend me to find like more on the behavioral or more on mental.
Right, more along the lines of mental health versus actual medical condition.
Yes.
Right, which is chronic inflammation and brain damage, which comes from mold. How soon after starting the BioNexus herbal protocol did you see any changes, and what were the changes?
Yeah, so the first changes I noticed with her, like the hand flapping decreased, and then she's more like focused.
More focused?
Yeah, but like it has also the die-off you shared in your podcast. Sometimes, oh, I need to just drop small amount of the medicine just to control. But yeah, it seems it has still even like a small dosage because of her, a lot of symptoms, right? But after that, just continuing with the medication for how many months? She's been like, now she had a lot of communication. She can communicate well. She can cook. She can Now this time I am teaching her, or she is eager to bake her own organic gluten-free bread
There is PAMS, pandas, basal ganglia damage. There is gray matter atrophy. There is white matter in the brain. There's edema or swelling that happens from mold exposure and other environmental toxins. You know, it's not just mold, right? When you're living in a moldy environment, there are so many other toxins and bacteria, actinos and endotoxins that come into play, and those affect the health as well. So it's a big deal that she's able to change her voice quality back to age appropriate.
Yes.
So her brain is starting to heal. When I gave you neurological support level 2, that level 1 brings inflammation down, and neurological level 2, it starts to repair the damage. I'm happy to hear that you experienced die-off. I mean, it's not fun to watch because it's your child, but you have to understand, keep in mind that die-off means that the medicines are working. Not everybody gets die-off, of course, but when you do, then you know that number 1, infection load was very high. Number 2, that the medicines are working. They're on track. That's the reason why, her brain improved, her gut improved, behavior improved, independence, cognitive, language, what else? Mathematics, all of these things. Resi, being a 13-year-old girl, neurotypical, is hard enough. But at least in the United States, I think pretty much everywhere in the world, being a teenager is really hard with all the hormones, and especially for girls, right? And then for Maria to go through all of these additional challenges, it must have been so hard. And I'm really glad we found each other and we were able to help her.
Yeah, and also you mentioned about hormonal. Yes. She had also the premenstrual syndrome. It's like that whenever she had a period 1 week before or days before, she's difficult.
You guys were exposed to mold, and for your daughter, she experienced a severe decline, and as the decline is experienced, that affects the immune system, becomes dysfunctional as well, the innate immunity, the adaptive immunity. And when immune system becomes dysfunctional, there are opportunistic infections that come into play. There are other toxins that start to accumulate in the body. That is why you have to run the proper labs. And then, it sounds so logical, but it is rare. With me as well, Resi, for Brian, my son, we had to visit 19 specialists in 4 or 5 different countries to be able to understand what is going on. It was just mind-boggling. Everyone's giving us their, oh, it's mental. Oh, he's pretending. Oh, it is just, something he'll grow out of. Oh, it's asthma. No, it's not. And all they could give us was try steroids. I don't want to just blindly try steroids for my son, and the worst thing was I had an Ivy League infectious disease doctor telling me that, have you considered, maybe it's just drama, maybe he's just pretending. It's just some of the things you hear are just ridiculous.
Yeah, I experienced also too, one of the doctor, then she's just keeping me saying, oh, you need to coordinate with the psychiatrist because your recommendation is for the psychiatrist. But I told her I already working with her for how many months and years, and then keeping increasing the medicine because I just want to have referral to some doctors for a specialist or for PANS or for neuro. That's why when they ask for the hospital that has checking for PANS, it will take 1 year, less than 1 year to wait. So I decided myself to find to find a doctor directly. So that's why I keep on searching, and then we found each other.
And she can just have a good life ahead of her now.
Yes. Yeah. Thank you, Dr. Dasher.
Oh, absolutely. My pleasure. It was really nice to have met you and have met Maria, because this was sort of a unique case for me as well. So that's why I'm glad you're sharing this podcast, your story on this podcast today. And I hope that those listening will understand and will also pass this information on to friends and family that if you have anyone diagnosed with any kind of mental illness, you have to get immediate support, of course, to be safe, but you have to dig deeper. You have to see if there is any other reasons for the symptoms that are being experienced, depression, anxiety, OCD, suicidal thoughts. I had one patient with all of that and homicidal thoughts as well, for the younger sister, and even acted upon those impulses once or twice. And it was just really hard to believe that a 9-year-old would do all of that. All right, so that brings us to the end of this fascinating podcast with Resi today. I hope it was informational, and I will see you all at the next episode of the BioNexus Health Podcast. Take care. Namaste.
Thank you for joining Master Herbalist Dr. Jodi A. Dashaw, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.